most of the damage has been what the water brought in, and what the water did to some of these communities. A lot of the fishing boats were washed up shore, maybe some about 400 or 500 yards up in the shore, and the boats came through the neighborhood, through the streets. So some of the boats ended up on cross streets, maybe half a kilometer away. The impact has been because they live off of fishing. A lot of them can't fish because the waters are polluted. The universities are coming out to test the water, but that's not going to happen until next week. So the fishermen can't go out. They're not allowed to have fishing boats out in the water. So nobody's generating income at the moment. They just lost everything. And you see refrigerators outside, dishwasher, there's flies everywhere. There's like a film of black mud all over town. I mean, it's everywhere. You see it on the streets. It's inside the houses. There's been one town which we're going to next where the clinic was actually just La Posta, which they call it, POSTA, was just washed into the ocean. It just disappeared. The tsunami just wiped it away. And then the hospital, on the way into Concepcion, in the airport, the big, large clinics, I'm talking 4 or 5-story clinics, had glass broken. Some of them have structural damage. So I'm seeing that. The earthquakes continue, and the International Earthquake Corps still does have a team on call should we require to send a team down. But as of right now, we're working with volunteer doctors within the area to be able to address this. Before the tsunami, the way it worked is that once a month or once every 2 months, doctors would make from Arauco, they would make rounds. That stopped. It's not going on at the moment. We would like the mobile clinics to come out, and because during this time, you've got the trauma, you've got, the injuries that have taken place. People are cleaning up, they're stepping on nails, people have fallen, they're getting hurt. There's dehydration. Because people are living in tents, there's tent cities that are popping up everywhere. In places where cattle used to be, children are getting bit, by bugs. We saw a couple of swollen hands. Children had been bit in the nighttime. So the mobile clinics will address this immediate need until things get back and running again. One of the things that we would like to do is to actually be able to incorporate a mental health component into this, where, speaking with the children, trying to calm them, what's going on. Children are afraid to leave their parents. They're, at night, there's just any type of shake, any type of movement, they're just, on their toes. But their immediate concerns right now is shelter. They're concerned about shelter. They're concerned about the bad weather's coming, and then just the respiratory infections that come along with that. Those are the two main concerns. So it's respiratory infections, it's sickness in the children that's their concern, as well as the temperatures that are going to start to change.